This is hella sideways, but I feel like maybe it's a vibe. Maybe it's like something new. That car was so loud. I'm trying to figure out where I can put this this phone. There's girl, hey! I feel like this lip gloss is making me look so greasy and like like I just look oily. This thing, sis. I don't know if that's any better, quite honestly. I think it is a little. Oh my goodness. Okay, and we're back. I'm gonna make this really quick and do the rest of it when I get there, but on my way to my pre-op appointment today, like the day I'm recording this, I will be posting like my video about like getting it approved through insurance and all of that good stuff. And then I don't know if I'm gonna record in there. I don't know if I'm there yet, like with my phone and stuff. Like I just don't know if I'm there. I might like try to sneak like the audio in and just like include that, because yeah, I don't know how I feel about being like, hey, yeah, I have a YouTube channel and I'm documenting this journey. I don't know. So yeah, I will touch base with you guys once I get there, and yeah, see you in a bit.
Hello, hi, good to see you. I like your hair. Thank you. I was trying to be, I don't know, let's feel it pink.
She thinks she's Barbie today.
Yeah, I was channeling my inner Barbie. Any questions about all that paperwork? I know it was a lot.
No, she explained it really well.
Good.
Everything's good.
And you're
I've
ready?
done this a few times.
Yeah.
Just a few.
She kind of knows her stuff.
I'm glad.
I think I could recite it in my sleep.
I know. That's what just happened. I was seeing another breast reduction consult, and Grace, my MA,
Yeah.
she sent my spiel for
Yeah.
like word for word, and I walked in there, and the patient's like, she told me about the guy named Schnurr. I was like, yes.
The guy named Schnurr.
So I just have to review a specific risk of the surgery with you. Anytime you have general anesthesia, you can have a DVT or PE, which is a blood clot that starts in the legs and moves around your body. Make sure that you don't get that by not laying in bed.
Yeah, walking
all
around.
day. Yeah, walk around. don't just be a slug and do nothing. And I know you're a mom with 2 young kids, so you can't really do that. But just letting you know, don't do that. You can have infection anytime you have an incision, so we give you IV antibiotics before and Bivalve to take afterwards, and that's why we say no submerging until I say it's ready, until everything's all closed and watertight.
Okay.
You can have asymmetry. They're sisters, not twins.
Mm-hmm.
So I've never met a pair of twins. Never will meet a pair of twins. So we'll get them closer, but not perfect. Okay. And then you can have bleeding or hematoma, which is a collection of blood. The way that we prevent against that is I do my job in the OR and you do your job afterwards, making sure that you're not lifting anything heavy, bursting any clots and blood vessels. What a hematoma will look like is all of a sudden one breast gets really, really big and starts expanding and you start having more pain and firmness. If that happens, then you have to go back to the operating room and control the bleeding. Okay?
Okay.
And then unfavorable scarring, if you haven't had any keloids or hypertrophic scars in the past, unlikely, but those of us with more melanin tend to have that tendency. If I notice that your scars are getting more thick, post-operatively, we can do steroid injections and things to calm them down. Your future mammograms will show that you had a breast reduction. It shows all the old scars, so if you want to be like super on top of things, when you get your first mammogram, you can save the CD, the images. So in the future, if anyone ever gets excited about something looking weird, they can always compare it back to your baseline scars.
Okay.
I cannot prevent future aging or gravity. So haven't figured that out yet. So your breasts are how they are right now, but if you have more kids, big weight fluctuations, menopause, all those lovely things that life throws at us, will change the shape of your breast. Okay? And you can have delayed wound healing, especially at the T-junction where we talked about, where the vertical meets the horizontal. That area tends to break down. I tell everyone to expect it. If it doesn't happen, then great. But if it does, nothing in the world, we just put ointment on it to let it heal in and increase your protein intake, okay? And then anytime you make an incision all the way around the nipple, you can change the nipple sensation, which we already talked about, but also if your blood supply has been kind of pulled and damaged with time, with just weight pulling on it, sometimes the artery is not as strong as it once was, and then the nipples can show that, I don't know, some congestion. What that looks like is like the nipple starts getting darker, more purple. If I feel like your veins aren't opening up, I will give you a cream DMSO to put on your nipples afterwards to help the veins open up. There's always a chance that also that it can just die. What that doesn't look like is when the nipple falls off in your laundry. It's not like that. It looks like a wound that opens up, kind of breaks down. We put ointment on it and let it heal in. Okay? And then with those of us with darker areolas, sometimes we have hypopigmentation or loss of color if you have any of those healing issues with your nipples afterwards. What that looks like is like a pinker color instead of black in some areas or brown in some areas. If that doesn't resolve after 6 months to a year, you can always get like tattoo fill in and make it look the same color. Okay? Most people are like, whatever, that's fine. But I just like to warn you of all the possibilities, you know. Any questions about all that?
No.
Okay. Your measurements are alrighty, and it's 7. You just told me I always
7:52.
7:52. 7:52. Okay. Do you mind if I take a look and review our plan?
No, go ahead.
You're over this? You want this done already?
I do.
I feel like most of my girls are like, can we just do this
Please.
yesterday? Okay. So this measurement from your nipple to your sternal notch is not quite at 40, but we're pretty close. We're at 38. What that means is that your arteries, if you imagine if you saw a blood vessel being pulled like this, it may not be the strongest blood vessel, so we may have to do that cream afterwards, okay? But you're okay with trying to leave it on the pedicle, or did we talk about free nipple graft or anything
We
like that?
did.
Yeah. What are your thoughts?
I would love to keep my nipple normal if possible.
Yeah. So we'll keep it on the blood supply from below, this
Yeah.
inferior pedicle. You have 4 that kind of come in, 1 from the top, 2 from the side, 1 from the bottom. The one from the bottom tends to be the strongest after all this time and stretch, so we'll do that one. And then just know that it may have, some struggles afterwards. You may have to use cream, you may have some breakdown on the nipple. But that way I'm, for my younger patients that are, teenagers, they have a whole future ahead of them of possible breastfeeding, and anyone who wants to preserve their nipple sensation, that's the best way.
Okay, awesome.
Okay?
Love that plan.
And then we have to take off 7, 52. So that's going to be a decent amount of this tissue. You're okay with being like a BC?
I don't know if I would look, if they would look like how I want them as like a BC, because I called my insurance company and they said that I guess they didn't give an amount that needed to be taken out, that we would discuss it. So, like preferably like around the C range, but I don't know if I'd want to be as small as a B.
Okay. Yeah, so insurance always tells you all the wrong thing.
Oh, okay.
So they like pretty much always, for Blue Cross, Aetna, United, all the main ones, except for TRICARE. TRICARE will be okay, the military one, with discussions. But most of them, if they need to, they'll try and tell you, oh, we'll do whatever the doctor says. But if we don't meet the SNR, the amount minimum off, we document it on the day of surgery, we weigh it, we take pictures as proof. And then if we don't make it, they'll slap you with a bill afterwards.
Okay.
I just like to warn.
So there's a chance I could be as small as like a B cut. Okay.
But you'll be perky.
Yeah, that's really small though. Okay.
The reason why I say that is also because a lot of your tissue has been pulled. You know, like it's all down here. And so because they're what's right behind your nipple, like coming this way. But it's move that all the way up, and to be able to close around it, you have to take off, the extra on the sides. So, but if you look at it, pregnancy has done a number on you. So if you feel the tissue, it's not super dense, even though there's a lot of volume. So it just may not weigh as much. So.
Okay.
But if you don't like, being, if we have to be a B, at least you'll be perky, and then if you don't like it, we can always put an implant in later, like 6 months later, if you want.
I don't have all the money in the world to do that. Yeah, okay, that's something to think about, because I really don't want to be that small. So you'd have to take out tissue until the scale says like 700, whatever the thing is. Okay, even though I'm not, what did I just say? Tissue dense.
So I'm looking here too, just because there's 2 different numbers in here. Let's see where I got that here. So I saw 750 and a 650. So see, that says 742. But then there was another card in there that said 650. That says 750 each. That says 650.
That's because this part is like,
Okay, I just want to make sure.
I suppose they want to input this part. Yeah.
Make sure we have the right one.
And I'm not going to push you to the point of, causing damage or not having nipple viability. Like, if I have to cut it off at a certain point, I will. But only if it's like at the point where, like I can't preserve the nipple or something like that. Okay?
Okay, because wasn't there a risk if I go down too small, my nipple viability will die?
That's where I limit it. So like I'm not gonna do damage to you because the insurance company is making me. If I feel like I can't take off anymore and it's unsafe for your nipple or for your breast tissue, I'll stop.
Okay. Okay. So hopefully that'll save me from being.
Yeah.
Okay.
But I just like to warn you,
Yeah.
like insurance companies will tell you one thing, and then, if you don't meet it, then later you're going to have to deal with them coming after you.
Okay.
It's the unfortunate world that we live in.
Okay.
Where insurance, companies dictate medical care, which I'm sure you're already seeing how doctors and surgeons and everyone are not happy with it.
Yeah. Okay.
But that's why we're doing more concierge medicine. And a lot of places are actually like stopping taking insurance and stuff, so you don't have to deal with them telling you what you can and can't do.
Right.
Yeah.
Okay.
Okay. I know that doesn't give you a lot of confidence.
Yeah.
Yeah.
Okay. Okay.
You okay with that?
Yep.
Pictures? We will get pictures.
All right. See you, dear.
Thank you.
I love a chaotic vlog. Why did I say it like that? Vlog. I love a chaotic vlog. Like, I love when there's so many different parts. You're like, is this still the same person I'm watching? Because there's been a million different pieces and parts to the video. But yes, it's still me. I'm here. Let me put on some lip gloss because that's crusty. That was crusty. That's real crusty. Hold on. Not too much because you don't want to look greasy. Not too much. Girl. Anyway, so yes, I'm still me. I forgot. I don't even know what I want to talk about. It has occurred to me that I didn't pick up the video after my consultation, and hopefully there's some clips I can put to explain as to why that happened. Because when I was in there, she told me that I would be going down to a C or a B, and I was like, wait a second, a B cup is crazy on my body. So for like a couple days, we were going back and forth with my insurance provider and like the surgeon to see what it would go down to there, because they were saying like, yeah, we go by the Schnur scale, but we also really go by what the surgeon suggests is best for the patient or the person, which is me. So it's just kind of like contradicting itself. But anyway, within that time, I have just kind of been okay with the fact that I am just going to go down to a C or a B cup, and I'm going to be happy with it, because honestly, having the large size that I have now is just not something I want anymore. And I think it was more so like vain at first, like, oh, little boobs, like a B cup. But then I was just like, Ayana, honestly, you have back pain. You don't want to be stuck with, I don't want these big behind cha-chas anymore. Like, I really don't. Like, that's the last thing I honestly want to have to deal with day in and day out. Finding bras, trying to find something cute to wear and not looking appropriate because your boobs bust out, but you don't have anywhere else to put your titties because you can't put them in your bag, child. You gotta wear them on your chest. So it's whatever, and I am happy with the size I go down to. Now, a little TMI, a little disclaimer, it's gonna get a little graphic. But so when I had my first consultation, they were telling me like, hey, I'm sorry I have blue on my tongue. I stole some of my husband's warheads, and that might be distracting, but I do brush my teeth and all of that. I had candy after I brushed my teeth. Anywho, so when I had my first consultation, the first doctor, he was like, well, if you go down to what the Schnur scale would suggest, you are going to have a free nipple graft. And basically that's when the blood supply to your nipple cuts off, it's dead, and you know, you won't have any more sensation in your nipples, and you won't be able to like breastfeed and things like that. They basically cut and paste your nipple on. And they were asking me, well, the doctor at my most recent consultation, which is the second doctor I had a consultation with, was asking me, hey, are you okay with the free nipple graft? I'm like, honestly, no. I would love to keep the sensation to my boobs. Anyway, I would love to keep the sensation. Everybody wants to pass my vehicle. Anyways, I'm gonna keep vlogging. Who cares? Everybody, I was like, yeah, no, babe. I need that. I like my nipples. And so I would like to keep my nipple sensation. So she was saying during surgery, if she gets concerned about the viability of my nipple, then, you know, she wouldn't reduce the size anymore. So that's something that like I am at least at peace with. Like, I'm going to keep my nipple intact. So that's the update. So I just got out of Walmart, or not Walmart. no tea, no shade. I just got out of Walmart, and you have to buy antibacterial soap along with other things. I have to look at that again, but I bought my antibacterial dial soap that she was telling me to get. And do your skincare, because it's popping. Mine is popping, baby. It's giving. It is giving. Anywho, I have to go to Trader Joe's. Actually, I'm going for the first time, and I'll pick this back up if I have anything else to say. I really don't think anything else is needed to say about the consultation. I did want to give the update with mine. It took me about a week to decide if I really, well, actually I knew, am I yelling? I actually knew like 2 hours after leaving that I was still gonna go through with the breast reduction, even if it meant me being a B cup, because they're just, baby, it's give me new perky boobies, please. I need that. So I knew, but like I wanted to, obviously, if I'm paying money, I wanted to be left with as close to what I desired as I possibly could. So I was just kind of going back and forth with my patient coordinators and seeing what we could do. So the plan is, if anything is anything, we're gonna keep my nipples. So that's all you can ask for. And then so people who are going like the traditional route, I guess, the expectation after well, doing your consultation, you know, you go to your consultation, they're gonna tell you, hey, you can't take, well, they're gonna ask you like medications you're taking, and they're gonna tell you like if you need to stop beforehand. I have to stop my birth, well, actually yesterday, you have to stop 2 weeks before your surgery. So I had to stop taking my birth control yesterday. I have to stop taking like my vitamins and supplements in a week, but I already went off of those. And then you're supposed to pay there. I didn't pay that day because I was still like, I'm not going to pay for little boobies. And then there's a disclaimer that they give you, and basically sometimes your insurance provider, although they give a pre-authorization, they can always come back and say, hey, no, we're not covering this because you didn't take enough out, or whatever the case may be. So with me being a little skeptical on the size at that time, I told them I don't want to pay right now if I'm going to get stuck with a cup size I don't want, and then there's still a possibility of me paying after the fact. So it was like a lose-lose. Like I get small boobs and stuck with a bill. But obviously since then we have all come to an agreement, and then I paid over the phone yesterday. You give your card information, you pay what you need to pay. So yeah, I paid for it, and surgery is set for October 6th. And yeah, I think I'm gonna have another video after this. I want to do like a before and after video for like the clothes I have. And I was going through my closet, and I have really old clothes I've never been able to wear, but I love them so much, and I wanted to keep them because I'm like, oh, maybe I'll get my boobs done one day. So like, they're out of style. Like I don't really think people are wearing it anymore. However, I still do want to do that. I'm sorry if this thing is distracting. I have the sunroof on open. So yeah, I'm gonna do that, and then I think I'm gonna do my best to like vlog the day of, like on the way there and all of that good stuff, and like how I feel for like the next couple of days. But yeah, so it's official. It's official. I have paid for the surgery. I'm going to have the surgery, and I'm really excited. I'm gonna go purchase some stuff. I need to go get my prescriptions today. And yeah, so wanted to give that update. I don't know if there's anything after this clip, probably not, but I'll see y'all soon. I'll see y'all soon. Subscribe to my channel. Subscribe. I'm actually an adult. Contrary to what you see, I'm an adult. I look a little greasy, girl.